Thank you.
Of course. Yeah. It's okay to cry. It's okay to cry.
My first pregnancy, they did my epidural about 5 times. My second pregnancy, they stuck me with the needle about 7.
Girl, that's not normal. Kids, okay?
Yes, I was just nervous, I'm sorry.
You're good,
Oh my God, I wanna cry.
Why do you want to cry?
Because it feels good, like I don't have pain, like, ooh. Okay. It's just always hurting. Oh my God, that feels so good. I've never gone to a chiropractor. I've never like done stuff like this. Like, this is the first time it's about me and
All right, Rosa, so we're gonna just kind of rehash some things we said earlier, but I kind of want to tell us your story. You know, what are you feeling? What's going on with you? What brought you in here today?
Well, so I'm a stay-at-home mom, and I have been having a lot of back pains for the past 5 years. My first pregnancy, they did my epidural about 5 times. My second pregnancy, they stuck me with the needle about 7.
Jeez.
And yeah, it was so bad. So with that, already hurt, and then I want to say, I'm just nervous. I'm sorry.
You're good. You're good.
Okay.
So what's going on? What's going on?
No, no, I'm just nervous because I've never had my adjustments or anything.
Yeah.
But in high school, I also was a wrestler, so I know that also plays a big part in my back hurting.
For sure.
But other than that, I don't.
You don't have much.
Yeah, I don't have really much to say.
It's all right. So I'm gonna walk you through everything. I know it's like the first time I ever got adjusted. I was pretty nervous as well.
Yes.
So yeah, what's the worst part about everything that you deal with? Like, what makes it so bad?
The shooting up. I feel like pain's just shooting up my back, and anytime I want to bend, I feel my muscles just pulling. Like I can't. Like I'm a rubber band. I can't even like. I'm gonna snap or something.
Gotcha. So like we talked about it, there's obviously some things going on with your low back with the epidural shots that they poked you so many times.
Yeah.
That definitely took a whole toll in your low back as well, because that creates scar tissue in that space in there.
Oh yes.
So we're kind of having that as a little limiting factor, you know, to getting you better as well.
Correct.
But you know, it is what it is. We're gonna work with what we got and get you better in every way that we can.
Awesome.
Okay.
Thank you.
And look to the left as far as you can. Is there any pain with that?
Not really.
Okay. And then look to the right.
Yes.
Yes. What do you feel that?
I can feel it kind of right here.
Towards your like left trap in here?
Yes.
And it kind of shoots up into your neck?
Yes.
Gotcha. Okay. Let's have you look up as high as you can. It looks like it's tough, huh?
Yeah.
And you see how your head, I don't know if you noticed it, you kind of lean towards
I was
one.
going to say my head went to the right.
So
yes.
Part of that forward head curve you have going on in your x-ray there, it's whenever you try to go back, there's one side, and I feel like it's maybe your right side, they kind of just like lets it kind of drop this way, which is, we want it to be more symmetrical, okay? Now look down as far as you can.
Okay.
Ooh, same. You didn't know that you were this jacked up?
No.
Okay.
No.
Does it hurt going down?
Yeah.
Where?
Oh, sorry. For some reason on this side it hurt more.
All the way down over here?
Yeah.
Wow. Okay.
Yeah, to this side.
So we'll keep a note of that as well.
Okay.
Go down and touch your toes if you can.
Bye.
Ooh. Okay.
Okay.
So it kind of just comes into like a stop.
Yeah.
Okay, gotcha. Keep this leg straight, lift it up as high as you can. It looks kind of tough.
Yes.
And you're having to use a lot of effort, right?
Yeah.
Okay, bring it down. Do the other one. Woo! It had to pop in order for you to get even further.
I can't go more than that.
Okay. Alrighty, let's get you seated again, okay?
Okay.
So this is why it's good, you know, seeing a chiropractor, because you get to see how your spine is, and I mean, I don't know if any of this scares you for your future.
Yeah, it does, definitely. Like, I need to come more often so I can get this done.
Yeah.
Yeah, I have kids that I need to be there for.
Is it hard to play with them sometimes?
Yes,
okay.
I feel horrible sometimes when I'm like, Mommy's done, you know?
And I think that's whenever it gets, that's when it kind of reaches that, like, when the pain is not just like at the level of you, it's at the level, hurts a little bit?
No, it's okay.
Okay. I was like, this should feel pretty good.
Yeah.
Yeah, it gets to the point where it's okay. You can deal with your pain. You can push through it, right? You have kids. Yes. You're gonna make it work and whatever. But then when it's like, okay, now your kids are being affected with it.
That's when I'm like, okay, a whole different. Yes. I'm like, okay, now it's not just affecting me, it's affecting their lives. Yeah. I gotta do something.
And you're younger than me. Like, for you to be feeling pain like this, it's not a good thing.
Yeah, I know.
But, you know, I'm glad you took that leap of faith. You know, you listened to your husband, so thank you, husband. There.
Yes, thank you, husband.
You know, he kind of pushed you to do this. You're a little nervous, you know, and I get it. You know, it's like a weird thing to do. I mean, the good thing, we're not gonna be poking you inside.
I know.
We're not poking you. I'm pushing into your, you know, your joints and getting things to go better. The side effects of this are, you feel better. You sleep better, because you said sleep has been bad too. Yeah,
I can't. I've been having trouble sleeping. Anytime I think I'm comfortable, my back, like, kind of twitches. So I have to move, and I'm usually asleep on my right side.
Okay.
But yeah, it's very hard for me to sleep. I have to put a pillow underneath my back, if anything.
Oh yeah, because you have like that dip in here, right?
Dip, okay. Yes.
So we can see on your X-rays you have what we call hyperlordosis. So meaning that your low back curves way too much, so you have this anterior pelvic tilt. Yeah. So we need to flatten out the curve more so that we can decrease that dip in here. Okay. It's normal to have a dip in there, but we just can't have it too accentuated.
Yes.
Okay.
Okay.
So we're gonna push down into here. I'm not adjusting you yet. Okay. I gotcha. Okay. So we're just gonna push into here.
Okay.
It may feel a little bit tender, but nothing crazy. Okay. How does that feel?
I don't feel it.
Okay. Okay. Good. So what are some of your goals with everything that we're doing here? Like, if we could magically just pop all the pain out of there.
I really want to start going back to jiu-jitsu and... To
where?
Jiu-jitsu and wrestling. Oh, I kind of want to go back to doing that.
Oh, you did jiu-jitsu as well?
Yes.
Oh, that's pretty dope.
But I don't know, because I do want to get more physically active. That's my biggest goal with the alignments.
Gotcha. So
I want to get back in shape.
Yeah, I mean, jiu-jitsu is fun.
Yeah.
How long did you do it for?
I did it for about a year.
Okay. Did you do it pretty consistently, or kind of a little bit like on and off and whatnot?
It was on and off.
Yeah, and you have kids. I'm sure it's not that easy. Whenever I did it, I was still in high school, so I had all the time in the world. Oh, man. I got my blue belt in like a year and a half, so I was like, oh, cool.
Oh, man, I wish.
But, so you did wrestling and jiu-jitsu.
Yes.
Oh, man, I definitely don't want to mess with you outside in the streets.
You don't. You don't.
Definitely don't want to catch you in 6th Street.
No.
Oh, man. Okay, so next one here, you're going to feel like a little thump in the back here, like this, like multiple thumps.
Okay.
It should feel pretty good, too. It's going to feel a little strange, though. Right there. All right. Look to the left as far as you can again.
Okay. Oh, that's a lot better.
Way better.
Yeah.
And then look to your right.
Okay. Oh, wow. That's like night and day.
Exactly. So what do you feel different now?
Like I can actually move. Like before when I went this way, I could feel my back, my right side, tense up. And then right now when I move to the right, it just feels like you put oil on my neck or something. It just feels perfect, like clean. I injected you with WD-40. Yeah, exactly what it felt like.
Yeah. Okay. Houdini. All right, so I think it'd be better if we start with your neck. Okay. For you to kind of just get through, like, I guess maybe the most scary part for you, honestly. Okay. That way you're just like,
relaxed.
Know, I like how I did. I got my tattoo on my ribs here. I knew it was gonna be the worst. So I feel like if we do kind of like the
worst part of it, okay.
Well, it seems like it's the worst part, but I think you're gonna like it the most, honestly. Okay. You're gonna be like, oh my god, that's like the best thing ever.
Okay.
Then you become like a crack addict.
So, a chiropractor.
Yes. Yeah, sure. Do you ever get any headaches?
Yes.
You do? How often, like let's say in a week?
I want to say at least twice a week.
Girl, that's not normal.
I know.
5 in a year for a woman is normal. Oh my god. Okay. I mean, you have kids, okay?
Yes. Oh my goodness. Oh my god. Can I move? No, right?
Yeah, you can move. You can.
That felt amazing. Literally amazing. Oh my god,
Why do you want to cry?
Because it feels good. Like I don't have pain. Like, ooh. Okay. That felt so good.
I mean, has it been emotional for you to deal with everything you deal with?
Yeah, because I mean, it's just always hurting. Oh my God, that feels so good.
Yeah, no, it's okay. I mean, there you go.
Ooh. Oh my God, that I literally don't feel like nerve. My nerve is pinching. Thank you.
No, yeah, I'm glad you came here today.
Yes,
on
me
your
too.
anniversary day. I mean,
yeah, gotta get right. Okay.
No, I mean,
Okay.
I'm glad you made the decision because honestly, like we talked about it, there's so many things going on with your spine that if they don't get taken care of anytime soon, they will get bad, right? And that's just the reality of things with anything. If you know you're aware of something that's going on with your body and you just leave it untreated, at one point it's gonna fail again, right? But usually it comes back with vengeance. So I'm really glad that you're here today. Okay?
Yes, no, me too. I'm very glad.
So we're gonna do the other side now.
Okay.
All right.
Okay.
So good. Here, I gotcha. There we go. So I'm gonna just like gently place my hand onto this bone here. So we're going into here.
Oh my God.
Whoa.
That was a lot. Oh my gosh.
It's very emotional for you?
Yeah.
It's okay. I mean, this is your time here. Like what comes to mind that makes you so emotional? It's okay. Like,
no, like I don't even know. Like just the popping. I feel like maybe I had like a lot of stress or something, but like I feel like I can breathe. Sorry.
That's okay. I think just you take on so many roles. You're a mom. You're probably cooking, cleaning. You're taking care of the kids. You're trying to maneuver through everything, right? And at times I think you just forget about your body.
About me, yeah.
Yeah. And that's very common. Like women will always put everything else behind them and forget themselves, right?
Yeah, no, this is the first time, like, I've never gone to a chiropractor. I've never, like, done stuff like this. Like, this is the first time it's about me. And I think that's also why I'm like I'm finally getting better.
Yeah. I mean, you have so many goals you want to reach. And it's like, if we can finally get your body to reach to that point, to be 100%, then you can reach that 100%, get back to jiu-jitsu, get back to, just writing and everything.
Yeah, thank you. Thank you for that. Okay, thank you.
Gotcha, yeah. Alrighty. So, you didn't expect you were going to cry here today, were you?
No, no.
No, I mean, I get it. It's just like, first time I ever got adjusted, it was like a really big adjustment. I cried myself too. Right. It's just when you store so many things for so long, eventually your body like lets go and it's like, I'm going to let it all go out there.
That's literally how it felt, like a wave of just, like it's gone.
Yeah.
Yeah. That's awesome.
We're like getting you back to a new body.
Yeah.
Okay. So I'm gonna grab your wrists here and this one here too.
Okay.
We're gonna check out the mid back and upper.
Okay.
Because you said that's where the pain shoots upwards too, right? So we got this here. I feel that this one is the one that's really sticking out. So just kind of follow my movement here. We're going back to the center here.
Okay.
Just like this, okay? So I want you to just take a breath in. All the way out. And we're gonna hug into this vertebrae.
Oh my God. Oh my God. It felt good. Oh my gosh, I'm just gonna lay here.
Good night.
Yes. No, yes, because, oh my God. I feel like I don't even have to move. Like I could finally go to sleep like this.
Yeah. Does your back
gosh.
feel flatter here?
No.
No?
It feels flatter on this side.
On the left side?
Yeah.
Okay. So we're kind of working our way backwards there.
Yeah, a little bit.
Alrighty. So let's go a little bit lower here too.
Okay.
Right at this junction here. It's called a thoracic lumbar junction. Okay. So we're gonna come around from the bottom here. Look towards me here.
Ooh.
Beautiful.
Okay, that felt better.
Call those like chiquitos pero picosos.
Yeah. No, yeah. My feet feel like I can like move them better.
That's good. You need that to work your knees and your hips.
Yeah, my toes feel a lot better.
More circulation there?
Yeah.
Gotcha. That's good. So you had the hip unleveling.
Yeah, on the right side.
You can feel it here, right? When I push on it? Yeah.
Yes.
So it's telling me some inflammation there too. So what I'm gonna start doing actually first is go down here to the ankles, and we're gonna pull this way, okay? And this way here too. There we go. I'm like messing up your hair here, sorry.
That's alright. It's already messed up.
Okay, so table's gonna come up underneath you. It's gonna jump like that. So we're gonna use this same pressure to push down into the hips, okay?
Okay.
It may sting a little bit. You won't feel any popping or clicking in here. We're simply trying to loosen up the hip joint. So when I push on it, it's nice and smooth, okay? Awesome. Okay. So let's check out this ankles here again. So they're actually straighter here now, more leveled. So as opposed to, since the right hip was really the issue, it was kind of bringing up the leg, making it look short, but now we leveled it out, okay? So what I want you to do is lay on your side facing me this way.
Okay, I was gonna say fall asleep because I'm already falling asleep.
So here. Yeah, I promise you, you're not gonna fall. Okay. I've never dropped anyone, okay? Yet.
Oh boy.
I'm just kidding. I gotcha. So we're pushing into here.
Oh, okay.
There we go.
Oh, that's good. Ooh. That's good.
Let's go to the other side.
Okay.
This is the kind of more stickier side where the biggest issue is at. So you may feel this one a little bit more, okay? We're gonna bring this here. So her pains actually shoot from this lower back into her mid back and kind of even up to your upper back too, right?
Yes.
So we have to really find this angle. Oh.
Oh, instant smile.
Go on your back there. Yeah.
Just lay on my back?
Yeah.
Okay. Like just.
Like that, yeah. How did you feel with that one?
Good. I felt good. Like there's no, I feel like there's no more like air bubbles in my back, if that makes sense.
Yeah, like the little popping ones?
Yeah,
Yeah,
it
we
feels good.
cleared a lot of that in there.
Okay, that's awesome.
Slide down towards your feet. How does it feel laying on your back there?
Good, my dip isn't as
Accentuated?
Yes, like my back's finally touching the yeah.
Crazy, huh?
Yes. Okay. Oh my gosh.
Yeah,
I'm gonna fall asleep like right here.
No, right? We need to have a nap room in here.
Yes, you do.
Every single day concerns me the most that we just need a nap room in here.
You do.
People just be like, all right, coming from out of town, you're gonna take a nap here.
Mm-hmm.
So I'm gonna decompress your spine too. I gotcha. Lift your head up again and help me take out all this here. Bring your head down. Good. Perfect. Nice. So you're gonna first feel a little stretch. If I pull just enough, you may feel a little pop. But I wanna get familiar with the tension in here, okay? So put your hands on your stomach, like that. And just kind of breathe in there to your stomach, like breathe in deep, all the way out, just like that.
Oh.
Bring your head up for a second.
Hold up.
It's okay. I'll leave it here.
Yes, please.
It's okay.
My God, that feels so good. Okay.
Can you imagine how many years you've lost sleep?
Shoot, at least 5 years.
That's a lot of years.
Oh my God. I am gonna fall asleep here. I am gonna fall asleep here.
You can take the white strap home too.
Awesome. Oh man.
I love it.
That's awesome.
I feel like coming in here, you had like so much tension in your body. You had more like tenseness in like kind of in your face, but then now I feel like your body's just like loose.
I feel like I can just like I can actually smile like without
not having to force it.
Yes.
So check this out. I want you to sit up again. I got you here. And then you're gonna go face down one more time.
Okay.
We're gonna retest those leg lifts.
Okay.
So the first ones were really bad.
Yes.
All right. Yeah, bring up the left one.
Okay, left.
Yep. Whoa.
Is it a big, it's a big difference.
It's a big difference. Yeah, bring that one down, do the other one. Oh my God.
Gosh. I couldn't even get this one up.
I know.
That's amazing.
Wow.
Oh my gosh, thank you.
You're very welcome.
That was awesome.
Put this on here.
My husband's gonna be happy about that.
I know. Right? What did he tell you?
That you better get my back right. So
No, you don't.
Oh, what did he say? No, he said, I'm nervous. He said, go ahead and make sure they fix your back so I can pop it out later.
Yeah, something like that. Yeah. All right, so it's gonna recheck everything over here, okay?
Okay.
Look to the left as far as you can.
Okay.
Way
Wow.
better. Look to the right.
Oh my gosh.
Way better.
Yeah.
Look straight forward. Let's look up.
Wow. There is no pull.
Exactly. And you're pretty much going symmetrical there.
Wow.
Look down.
Okay. It doesn't hurt. Oh my gosh. I don't feel like a freaking rubber band or anything.
Like a tight rubber band,
Yeah.
like super cold.
Oh my gosh.
Let's have you stand up.
Okay.
Take a step forward.
Okay.
Go down and touch your toes.
Shut up. Shut up. I haven't been able to do that. Thank you.
Oh, of course. Yeah. It's okay to cry. It's okay to cry. You deserve everything that you worked for today here.
I have not been able to do that in like a long time. Oh my gosh. Oh my gosh. Thank you.
Absolutely.
Hold on to this.
You're good. You can keep memory of it.
Yeah. My
So, what are your thoughts on everything today? I mean, what do you feel overall with your body, energy-wise,
gosh.
mentally, everything?
I feel like I can actually start going to the gym. Like I don't feel okay, like I have to, I actually feel like I want to go and start running and lifting weights now. Like,
yeah.
I feel like my body can do it now and
Good.
not like, okay, I'm going to be sore or I have to put ice or I have to do this and that. Like I feel like I'm young again.
Yeah, because you are. You're so young.
I know,
Yeah.
I know, but I feel it. Like I
Yeah.
feel it now. I don't feel like an old lady. Like I don't feel like I have to be like
Hunched
over or anything like that. Like
Right.
I can finally sit upright and there's no pain because I'm upright.
You're upright.
Yeah,
Good.
that's awesome.
I love it. You take a seat. Relax in there, okay? You did great.